I'm Cait.
And this is Crib Notes.
And we're nurse practitioners specializing in pediatric healthcare here with a COVID-19 pediatric update.
So we're talking to you today because last week the FDA and the CDC approved the COVID-19 vaccine for the 5 to 11 age group.
And this week, the American Committee on Immunization Practices approved the vaccine for distribution for these kids.
So to provide an update about COVID-19 infection here in the United States, 1.9 million children have been infected, 8,300 have been hospitalized, and very sadly, 94 of those children have died from COVID-19. This makes COVID-19 infection the number 8 killer of children 5 to 11 years old. Of those children hospitalized, 32% have had no underlying conditions, meaning that COVID-19 severe infection is random. We don't know how to predict those children that will get seriously ill. Some additional facts about COVID-19 infection is that this age group, the 5 to 11-year-olds, are much more likely to have multisystem inflammatory syndrome than any other age group. And we also know that 7 to 8% of children that are 5 to 11 will have long COVID, meaning they'll have symptoms that last weeks to months. So to provide an update about myocarditis and COVID-19, we've been asked many questions about this. Here in the United States, in the under 30 age group, there have been 86 million doses of COVID-19 vaccine administered. There have been 9 myocarditis-related deaths. All of those have been fully investigated and have been determined to be from classic myocarditis, which is related to an infection and not the vaccine. So to re-emphasize, here in the United States, there has not been one single case of myocarditis-related vaccine-induced death.
So one question we've been getting a lot of is, should I wait for my 11-year-old to turn 12 so they can get the higher dose of the vaccine? And the answer is a resounding no. We want your child vaccinated soon because COVID is in the community and it's out there and still very much a threat. So you don't want to wait those few weeks or months to have your child get the 12-year-old dose. The vaccine is not weight-based. It's based on your age-related immune response. So whatever age you are when you get the vaccine, you're the right age to get the vaccine dose that you are getting.
Another question that we have been receiving is, should my child who recently had COVID-19 be vaccinated? And the answer is yes. Natural protection is very random. We don't know who will mount a strong infection and who will not, but what we do know that the rate of reinfection for individuals who have had COVID-19 is 2 to 5 times higher than it would be from those that are vaccinated. And I can share personally that 2 days after we filmed our last episode, my children very unfortunately developed COVID-19 infection. So we are about 4 weeks out, and I will be hopefully vaccinating them early next week.
And actually, when researchers looked at children who had been infected with COVID-19, only 42% of those kids shockingly had antibodies. So that's alarmingly low, and we expected a little bit higher of a natural immune response. So it just makes more of a case to get that COVID vaccine.
So how soon after having COVID-19 can you receive the vaccine? The answer is as soon as you recovered from that infection. There is no waiting period. You can get it immediately, and we would certainly recommend that you do right away.
Right. Although you don't want to get it if you still have COVID and you still have symptomatic COVID. So wait till you've recovered and then get the jab. The other question we've been getting is, do I get COVID vaccines with other vaccines? And the answer is yes. If you want to get your flu shot at the same time, that is totally safe. If you just had your tetanus booster a week ago and you want to get the COVID vaccine, that's okay too.
Mm-hmm.
Thanks for watching this episode of Crib Notes.
Don't forget to like and subscribe.
Bye.
Bye.
Always remember, your child's health and wellness is nuanced by their unique physical makeup, as well as your family's particular social, economic, and environmental situation. Please always consult your own pediatric providers when making decisions about your child's care.